Welcome. This is a web conference hosted by Madrigal Pharmaceuticals in partnership with the Fatty Liver Foundation. We'll be talking about the patient journey and for individuals with NASH and get some perspective from a NASH clinical expert. Thank you for joining us. My name is Wayne Eskridge. I'm a patient advocate and founder of the Fatty Liver Foundation. I'm joined by Dr. Scott Friedman. Dr. Friedman, could you introduce yourself?
Hi, delighted to be with you, Wayne, and delighted to share some ideas and learn more about your patient journey. Just in terms of my formal title, I'm the Chief of the Division of Liver Diseases at the Icahn School of Medicine at Mount Sinai. I also have a role as the Dean for Therapeutic Discovery, and I've been conducting NIH-sponsored research to try to understand liver fibrosis now for almost 40 years. Wayne, I can start it off. You have a remarkable patient journey, and I think for listeners to learn more about it, that may resonate with them as well. It really wasn't easy and it wasn't straightforward. So tell us a little bit about how you came to be diagnosed with NASH and what happened next.
Well, not easy is unfortunately so common with NASH. I was a sort of a typical patient, but I had some atypical experiences. I was an incidental diagnosis in 2010 as a result of a gallbladder surgery. The surgeon came out and told my wife that I had cirrhosis and that I probably didn't have long to live. So that was a real shock because we had no idea that we were facing something like that. So we went through that. While he was in there, he took a biopsy. So I started to work with a gastroenterologist, and after a couple of months, he told me that I didn't have any liver problem at all. The pathology report came back and said there was really nothing very significant about my liver. Did not diagnose me as being cirrhotic, and none of my other blood tests showed anything. So after 3 months, I was sent on my way. But the surgeon had taken this picture, and it was really ugly, and my liver looked bad. You know, it was all lumpy and ugly. So for 4 years, I carried that picture around and talked to every doctor and had tests and did ultrasounds. And this is through my PCPs. Every time I had no indication of anything. All my blood work was fine. I eventually got to a gastro doc where I was doing a colonostomy, and I talked with him about it. So he did some blood work, and my iron was a bit high. So he sends me to a hematologist. He does a bunch of blood work and has an MRI done. He diagnoses me as having hemochromatosis. So 7 liters later, it was really obvious that I did not have hemochromatosis because my iron just crashed. I was almost iron-free there at the end. And through this time, I had been searching for information and reading about things. And actually, you may recall that I had inquired of you at Mount Sinai, and I was looking at one of your clinical trials and asked some questions, and you kindly explained the trial to me. And when I was at the point of insisting that I get referred to somewhere, I asked you where I might go. And you were kind enough to recommend that I check out Intermountain, where a friend of yours had just transferred from Mayo, and that was Dr. Charlton. And, this was because, like so many people in America, I live 300 miles from the nearest hepatologist, so it's hard for us here to get any services. But based on your recommendation, I connected with Charlton, and he, in no time at all, diagnosed me as having NASH cirrhosis, and at that time I was stage 4. My FibroScan was a 21.5. So that diagnostic journey, while a little bit different than a lot of people, is not uncommon, because people frequently go through years before they actually get to a place where they can be diagnosed.
Wow, that's quite a saga. Maybe I can clarify a couple of the comments you made for the listeners. So you said hemochromatosis and 7 liters later. So hemochromatosis is a genetic disorder of iron overload, and the mainstay of treatment is phlebotomy, or actually taking blood out. And so that's what I assume you were referring to, is taking those 7 liters out. And patients with hemochromatosis don't become anemic when that happens. But if the diagnosis is incorrect, you take that kind of blood out of an otherwise healthy person, and their iron count and their blood counts are going to go down. And that sounds like what's happened to you. The other point is you discussed the FibroScan, and that's a mainstay of early assessment of patients with liver disease that includes NASH. And it's a way of measuring the stiffness of the liver. And it's a device that's readily available at the bedside. It's one of several devices that can measure liver stiffness through a technology known as transient elastography. But I want to really get to the critical point, which is that you really had to persist and seek clarity for a disease and a diagnosis that most patients don't know they have. And frankly, most providers don't know about either. So maybe I'll digress for a minute and just explain for our listeners some of the background principles here about fatty liver and particularly NASH. So as most of us know, there's been a steady and precipitous increase in the average weight of Americans, and in fact of individuals all around the world. And at some point, and based on individual variability, many patients will not only develop obesity, but a series of problems known collectively as the metabolic syndrome, most prominent of which is diabetes, but it can also include high blood lipids, high blood pressure, other abnormalities, all of which raises the risk of liver disease, and not insignificantly raises the risk of cardiovascular disease as well. Patients who are developing this syndrome, typically in the setting of obesity, don't have any symptoms that tell them anything's going wrong in their liver. And the most common way individuals find out they have fatty liver disease is not actually through having surgery, as you did, Wayne. It's that their liver tests, when they see their healthcare providers, are somewhat abnormal and typically not that high that anyone gets particularly worried about it. And so that often leads individuals on a journey, but it takes that important first recognition that the patient may be at risk for fatty liver disease based on the fact that they have other features like diabetes and hypertension. And it takes a patient who's open-minded and willing to pursue a diagnosis. Now, you have a scientific background, Wayne, and so you were really determined to get to the truth. And I think you obviously saved your life in terms of bringing the information to the right expert, which is a hepatologist or a liver specialist, and then following his recommendations. And that, in turn, led you to create the Fatty Liver Foundation, which I think is a tremendous contribution to the field and, more importantly, to patients. So maybe you could tell us a little bit about the Fatty Liver Foundation, how you came to do this, and what its mission is.
Well, Scott, I'd love to, and thanks for that explanation. If I had known those things early on, it would have helped me immensely. And that's part of the motivation for the Fatty Liver Foundation, because as I went through my journey after diagnosis over the next year and a half, as a result of the counsel that I got from Dr. Charlton, I lost 30% of my weight, and my FibroScan results went down to a 9.6, which they are today. And that is a high stage 2 or low stage 3 kind of value, which is vastly safer for me than where I was at diagnosis. So what I did was effectively eliminate the fat and the inflammation and the damage that was being done. And so my liver is badly scarred, but it's stable. And I wanted to pass on that information to others. I had learned that the common experience for people with liver disease is that they don't do well. They don't make progress like we did. And they struggle to manage their weight loss and their exercise. And there's so much bad information out there on the internet, and so little good advice available to people that my wife and I decided that we should share what we knew and what we'd experienced. And so we founded the Fatty Liver Foundation for that purpose.